smiling this morning, aren't we?
It's made everybody smile. The tweets have already come in, the texts have already come in about our wonderful Kate and Derek coming home.
The news that he has been able to travel home and is living at home now with Kate and Darcy and Bill. Honestly, you know, this means an awful lot to us because, of course, we've shared this with Kate very personally. But when we come in and see the messages from you guys already at home, just saying how excited you are and how pleased you are.
It's made your day. It's made your day.
It is a really, it's the first step. It's the first step, and this is the really important thing in a very, very long journey for Derek and for Kate and for the family, trying to work out how it's going to unfold. Yes. There is 24-hour care for him at home. And from your perspective, obviously, you will have had patients that have been through moments like this and then have come home. So you understand how that transition from full-time rehab within a hospital environment to the home can be quite a scary, intimidating moment, can't it?
It is. It's scary for the patient and for the family as well. It's a lot for the family to cope with, and there'll be people coming in and out of the home to help Kate with Derek, and that will be really useful, and she'll be able to talk to them about how she's feeling as well. But I don't think we should underestimate how difficult this is going to be for the two of them, even though it's a step in the right direction. Anyone who is a full-time carer for a family member at home will know just how difficult it can be, and as positive as this is, and it really is positive, it's a lot of work for the family.
We feel a little bit, Richard, don't we? Over the years, we've prepared Kate for all sorts of things as her very good friends. But I'm not sure any of us have been prepared for what she's been through for the last year. So to have her and Derek reunited at home finally is quite a moment.
It's a godsend. It really is. You know, having been with her through this journey, all of us, of course, you know, be it virtually or texting, you know, as close as we could get to her, and just seeing her finally back in the studio when she came back. And then obviously closely following the journey since then. I mean, it's been absolutely heartbreaking. Many people at home have been in similar positions, of course, and Kate has always been, you know, has always said that, you know, it's not alone. She's not alone in fighting this. But it's not so much joy unconfined, but it's a relief, palpable relief for all of us.
It is amazing.
Just to imagine that family together again under one roof. And as we've seen here from the text and the tweets, and I'm sure there'll be many of them this morning, you know, that overwhelming support that Kate has had has carried her on this journey. It really has. Never underestimate.
Home for this moment. This is the, you know, she was anticipating the best possible outcome, which was him coming home, and thank goodness.
And never underestimate how those tweets and texts, the support that you guys at home have given Kate, has meant to her. It's impossible to overestimate it, actually.
And you will have seen in the documentary, of course, that Kate did sort of rip out the back of her house and get it all redone for this very moment, so that Derek could come home. And of course, part of what she was saying then, and what we've known ourselves, is that as many of you will have had people in hospital, people you can't go to see, or parents in care homes, anybody who's in a vulnerable state, and you haven't been able to give them your personal love, your personal attention, they haven't been able to hear your voice, you haven't been able to touch them. That actually, for somebody in recovery, you know, and not just survival mode, but in actual recovery, which is where Derek has been for these last few months, and rather than just trying to stay alive, he's been trying to recover. Actually, not having that contact with Kate, I think everybody in the medical field around him could see that that was having an effect on him. And it's interesting, isn't it? Because medicine is one thing, but actually the psychology, the mind, that there's a magic in the family, isn't there, that you can't replicate in a medical setting, no matter how much you try. The medication is one thing, but actually it's that contact with your children, hearing your children. That can have an enormous effect on someone's recovery, can't it?
It really can, you know, that psychological effect, as you say. But there are, you know, there's science behind that. When your family members come and see you, when there's touch involved, there's all sorts of chemical neurotransmitters that are produced in the brain that make you feel better as well. So it'll be nice for him to have that finally, and good for Kate as well.
Let's talk other positive things this morning, which is summer holidays. We've sort of been given a little bit of an insight into what summer holidays could look like. Both Ranveer and I, Dr. Amir, were very excited to read.
Going on holiday together?
Yes.
Is that what we're excited about? Are we about to announce this to the world? OK.
But no,
that's my dream.
Well, when we can sunbathe together, and actually, if we're sunbathing, we're going to be protecting ourselves from COVID. It would appear that sort of the sunshine is a really positive thing.
I love this story.
Well, yeah,
Oh,
maybe. I know. I'm
face.
sorry. OK, so there's been lots of spurious claims about sunlight throughout this pandemic. There was people saying that sunlight could kill the coronavirus.
Yeah.
Obviously, ex-President Trump
the idea?
suggested, filling our body with sunlight and killing the virus that way. This study has a bit more evidence behind it. They've looked at over 2,000 countries. It's done by the University of Edinburgh, and they suggest sunnier countries, people have a 32% less chance of dying from coronavirus. And that might be because of the sun. They think the sunlight actually stimulates your body to produce a chemical called nitric oxide, which can stop the virus from getting inside and replicating, possibly. But then this is where I have to kind of err on the side of caution. Countries like Brazil, very sunny, very high cases. Countries like India, again, very sunny, and now seeing a surge in cases. So I don't think we can rely on the sun to protect us from coronavirus.
But, yes. Well, OK, thanks.
Sorry.
Thanks, but no thanks.
Vitamin D is good for your immune system in general, but there isn't any proven link that it will protect you against coronavirus. But everybody in the UK should be taking vitamin D supplements, certainly between September and March.
Yeah.
Throughout
I tell you what
year.
I found, just anecdotally, actually, that from the few sort of 20-year-olds who are in my life, they've been going, I've been feeling really tired, don't know why. And all of them have gone to their doctors and they've all come back with going, oh, we need to take vitamin D. Is that something to do with lockdown in the sense that we've all been just sort of indoors and we haven't really, been able to go out to do anything and therefore we haven't really gone out even, maybe not even to do that one walk, and that in itself is not enough.
But also, this time of year, it's not unusual for people in the UK to be depleted in vitamin D because we just haven't had enough sunlight.
Is that what it makes
being
you feel
tired,
like?
achy bones, muscles is a common symptom of vitamin D deficiency.
Interesting.
But the last 6 months, we just haven't had enough sunlight to get our vitamin D levels up.
Can I just also ask you, it kind of relates to what we've just been talking to there, that there is also and what is enjoyable at the moment is that there is new data coming out, and this is giving us all hope because there's enough research in it now, that a single case in 1,000 is caught outdoors, i.e. that if you're outdoors, that actually the risk of catching coronavirus is very low. It's 1 in 1,000.
Yes, so this is something we've been saying for a while, but it's been proven in a study that's come out of the Republic of Ireland.
Yes.
And they say outdoors is probably one of the safest places to be during a pandemic because there's lots of ventilation, wind blowing particles that may contain the coronavirus away. And also a study from the US suggested actually 1 in 10,000 people get it from a surface. So it's very unlikely you get it from outdoors or touching surfaces. Indoor transmission is what it's all about. We've got to keep social distance. Airborne.
Not on surfaces or door handles necessarily.
No.
Yes.
So we've got to make sure ventilation indoors is really looked at, particularly in things like workplaces and schools as things reopen up.